Delighted to welcome into the Informer studio Nicole Dunn from Empower Aged Care. Good to have you on board. You and I have discussed aged care challenges for the better part of the last year. You've been one of our early contributors. But I want you to give us a bit of an overview because you've been involved. I'm talking about the Aged Care Royal Commission. What did you make of the findings? They've been really complicated. We had two different Royal Commissioners because they had massive problems with the Royal Commission from the very beginning. I think we lost a judge and then someone else got sick, so we've had a third Royal Commissioner come in. And at the end of it, the two different versions, they basically understand what's required, but they come at it from two totally different directions. So what have you made of it?
Yeah.
You're the professional, right in the middle of it. So I'm very keen to hear your perspective.
Yeah, so in terms of an overview, the Royal Commission started back in 2018 in October, and it's only just finished in February 2021.
But as we said, there were reasons for that,
Absolutely.
mitigating circumstances.
Absolutely. That final report that's just come out, which is titled Care, Dignity and Respect, really details 48 recommendations, which are across the full gamut of aged care, residential care, home care, care in rural and remote communities. And the recommendations are sort of, quite far-ranging. And so it's really going to be quite interesting from here to see what the government now adopts.
It's interesting you say 48 recommendations, and some of them far-reaching. I've noticed just lately a new ad on television, and it's about a woman who needs medical assistance, and she's now suddenly getting it really good service at home, almost as good as she would be getting at one of the better hospitals. Now, is that one of the messages that's coming through, and suddenly we're now hearing it in our everyday ads that are appearing right across the television platforms in each and every state in Australia?
Yeah, absolutely. So that message is really one of wanting to age in place, ageing in the home rather than in a residential aged care facility.
Which costs an awful lot of money.
It absolutely does. And many of the recommendations have been heavily focused on the need to improve and strengthen aged care services in a person's own home environment.
It almost goes against what we've been doing for the better part of the last 15, 20 years.
They're
not, we'll just put them in a nursing home or an aged care facility.
Yeah.
Now they're saying, whoa, we can't cope the way it's going because there's been a real boom in terms of the citizens ageing because that generation of Australians has finally caught up, and they're going to cost us an awful lot of money.
Yeah,
so much so that we really can't meet, what did you say? What were the findings, the key findings? What was it?
Care,
respect.
dignity and respect.
Care,
dignity and respect.
Respect. Yeah, to deliver all those three key ingredients in the proper fashion, it's going to cost an awful lot of money.
Absolutely.
And the truth of the matter is that governments of all persuasion have put it on the back burner or not really addressed it for the last 20, 30 years. Yeah. So nobody's a winner here. We're all losers, aren't we? And our elderly, the biggest losers.
Yeah, and until there is significant reform, you're absolutely right.
Now, you spoke at the Aged Care Royal Commission, which is why I want to ask you, what was the experience as a professional? You were given a chance to actually be involved. What was it like? How did you feel? Did you get a fair hearing?
Yeah, absolutely. So even though I'm a healthcare professional, I actually spoke about a personal experience. So I spoke about what it was like to be a carer for my grandmother, who was 83 at the time after she was diagnosed with pancreatic cancer. And I spoke at the Mildura hearing of the Royal Commission, and that hearing was aimed at the needs of family and carers of older Australians. So it was certainly a very harrowing yet powerful experience, and it really makes you realise that with these 48 recommendations, whilst there are lots of professionals and academics and providers that are speaking, at the heart of it are older Australians and their families and their carers who are actually experiencing the aged care system and are realising what needs to be changed. And that's where these recommendations are really coming from at the heart.
Yeah, they've realised that the challenges are acute, and we need to address them, and we need to do them as soon as we possibly can. What are the 3 key recommendations that came out of the Royal Commission?
Yeah, so look, whilst all the recommendations are important, there are certainly a few key ones which would really lead to quite significant reform. In particular, the need for a new Aged Care Act. And the reason they've said we need a new Aged Care Act is to actually put seniors front and centre with their needs and what their wishes are and understanding the care that they want. So the Act needs to be about them. So the importance of the Aged Care Act is that it's the legal framework for how aged care services are delivered and regulated. So that's why we need a new Act, essentially.
Are we going to see a raising of standards before you get maybe a licence to run an aged care facility? Because we've seen some come a cropper because they haven't done the right thing.
Yeah,
they haven't spent the money where it needed to be spent, or looked after the people looking after the aged care clients or patients.
Yeah, and certainly tightening up or replacing the Act completely would definitely lead to stronger regulation within aged care facilities.
How likely is it that the 3 key recommendations that you touch on are likely to be adopted by the current government?
Yeah, so I guess the other 2 key recommendations would be home care packages and the need
more of those. Yep.
Yeah, well, the recommendation is we actually need to completely clear the waiting list. So the commissioners have advised that waiting list needs to be gone by December this year. And at the moment, if you're waiting on a level 2, 3 and 4 home care package, you're waiting over 12 months to get it. So that's really a really important recommendation. And there was also a recommendation that there should only be a single assessment process for seniors to access aged care services. So at the moment
make it less complicated.
Make it less complicated. At the moment there are 2 pathways people can go down. They could either have an assessment by the Regional Assessment Service, known as RAS.
Yep.
That will link people in with services through councils and community health centres, or they can have an assessment through the Aged Care Assessment Service, so ACAS. That's driven by health professionals in public hospitals, and they have greater jurisdiction to also approve people for home care packages and residential care. But the issue of having 2 services that can do assessments is there can be red tape. And that can delay care that people need. So,
and you've been big on getting rid of as much as possible of that red tape because of the delays that have come from it.
Absolutely.
And you've also been, from day one, I know that you were always keen to get more people, if we can keep them at home.
Yes. Let's
see what we can do.
Absolutely.
Because one, I suppose spiritually and holistically, they feel that they're in surroundings that they understand and they know. They feel very comfortable, and that's got to help them in their latter years, huh?
Yeah, absolutely. Give people the best chance of being at home. So when you say, how likely are these recommendations to be adopted?
By December?
Yeah, well, the home care packages is by December, the Aged Care Act and the single assessment process not until 2023.
Whoa,
but okay. I certainly think the government will have to adopt a new Aged Care Act. If you're serious about reform, then you've got to be serious about a new Aged Care Act. That has to be adopted. I think it will be adopted. There's certainly been talk for quite some time about a single assessment process. That's been talked about for years, and I think that will be adopted. I'm probably a little less confident about the home care packages, I'm sorry to say. I think there'll be more funding injected. I think the waiting list will come down further. But
Is it because we haven't got enough professionals to go into the homes to do the job?
I think with home care packages, it's not enough funding, or if there's any unspent funds, that's not been redirected into new packages.
Okay.
So it's potentially twofold.
Okay. If you could say something to the federal government, what would your personal view be? What would your message to federal government be? As someone who's seen it from both sides.
Yeah.
You've had someone in your family.
Yep.
Yeah, who was in a very difficult place, and you did what you could, but also as a professional now who's part of the aged care system. You see it day in, day out from all the different perspectives and the narratives. You hear them around you all the time. What messages would you like to pass on?
Yeah, so I think, look, it doesn't get any bigger than a Royal Commission, it really doesn't. And it's a real fork in the road opportunity for the Morrison government to lead change in aged care, to lead that reform. And they really need to take on board that opportunity. And key to that will be transparency in the process. So the commissioners have given the government until the 31st of May to actually bring about a response in Parliament. And that response needs to be transparent in terms of what recommendations are they going to adopt, how are they going to do it, and by what time frame, because without transparency, there won't be reform. So I certainly hope that happens.
One last question. We saw so many people pointing fingers over the last 12 months. It's the federal government's responsibility. No, it's the state government's responsibility. Can we finally get now, with the Royal Commission out of the way, do we now have a better idea of whose responsibility aged care is? And is it still a shared responsibility because of the costs and the numbers?
Yeah, look, I think it's always going to be a shared responsibility because you're not just talking about aged care, you're also talking about healthcare in aged care. So it's always likely to be
wrapped up.
Yeah, it's always likely to be a shared responsibility. But now we actually have a clear roadmap in terms of what needs to be done to bring aged care in terms of to a level it needs to be at. And they've also introduced new positions to actually monitor, regulate and cross-check as well.
Nicole Dunn giving us a bit more of an insight as to what the Royal Commission found out and, more importantly, what needs to be done to make sure that our aged care system improves and improves quickly. Thank you, Nicole.
Thank you, George.